Dr. Mendel again. We're going over the torso model, and we call this the flat man model for cardiovascular system. And so this is not the proper heart for this model. I can't find it, but we'll hold it up here for demonstration purposes. But if the heart were sitting here, we see coming off the heart is the aorta. And so the aorta would come up and make an arch here, and the aorta dives down and forms the descending or thoracic aorta. There's three branches that come off the aorta. The first of which on the right side is the brachiocephalic artery. The middle artery coming off of it is the left common carotid. And then we have the third branch. This is actually anatomically incorrect. It shows us two branches, but there's three, like this. Brachiocephalic, left common carotid, and left subclavian. This kind of shows it as if there are two brachiocephalics, but that's anatomically incorrect. So we have three. The brachiocephalic changes and branches here. This is the right subclavian, which will go to the arm, the right common carotid, which will go up through the neck, the left common carotid, and the left subclavian arteries. We'll show you more of those on the other model. The only thing that we can see on this model here is the branching off the common carotid. We have the internal and external carotid. This one's the internal, that's the external. There's a branch here going to the thyroid. I wouldn't tag this for a test because it's just hard to see. Here we do see the what's supposed to be the common carotid, and then the branching of the internal and external. If we look as far as veins for these, we have the superior vena cava, which has a branch straying into it, which is the right and left brachiocephalic. We have the right subclavian, the left subclavian, the left jugular vein, and over here would be also the right jugular. So we have the jugulars, the subclavians, the right and left brachiocephalic, and the superior vena cava. Let's talk about the vessels from the lung. Remember that they're the opposite color of the rest of the body. This is actually a vein, the pulmonary vein. Why is it red? Because it just came from the lung and it has freshly oxygenated blood. The blue one would be the pulmonary artery. Then why is it blue? Because it is deoxygenated blood. It's coming from the heart, hasn't been to the lung yet. Therefore, it is this color. When you look at the aortic arch going down, we have the thoracic or descending aorta. It pierces through the diaphragm and comes out as the abdominal aorta. The abdominal aorta has 5 major branches, the first being the celiac trunk. The celiac trunk has 3 branches. One is the hepatic artery, the left gastric, and the splenic artery. There's an artery that comes off right here, which is the superior mesenteric. We see the renal artery and the renal vein bilaterally. This is the gonadal artery coming down on both sides. There should be another artery right here called the inferior mesenteric. We see that the abdominal aorta splits into the common iliac artery. It divides here as the internal iliac, the external iliac artery, and after it crosses out of the abdomen and goes into the leg, the external iliac switches names to the femoral artery. That's it for this torso.